Welcome to today's webinar, 5 Key Steps to Disaster Preparedness for Carers. So this is part of our Lunchtime Learning series as part of National Carers Week. So session 2, we had session 1 on Monday, which was focusing on the release of the first results of the 2024 National Carer Survey. And we have a third session coming up on Friday, which I will speak to you about at the end. So my name is Sarah Judd-Lamb. I'm the Executive Manager, Policy Development and Research at Carers New South Wales. And I'm just going to be kicking off today and then handing over to my colleague, Courtney, who will be delivering the presentation. So I want to start today by acknowledging the traditional custodians of the lands that everyone is joining from today. For me, in North Sydney, that's the Gorogal people, and I extend my respect to elders past and present here and to all the lands represented. You're welcome to mention your lands that you're on today in the chat if you would like. And I also extend my respect to all the many Aboriginal and Torres Strait Islander carers and communities. Just a little bit about Carers New South Wales before we jump into the session today. So if you're not aware of us, we're the peak non-government organisation for family and friend carers in New South Wales. And those are just some of the key things that we focus on. Our next slide just gives a bit of an overview of who carers are. So our presentation today is not only about carers, but our organisation focuses on, like I said, family and friend carers, and there's nearly 1 million of those in New South Wales and 3 million nationally. So this week is National Carers Week. We're recognising the important contribution of carers to the community. And as part of National Carers Week, Carers New South Wales likes to highlight some of the work that we're doing in this space. And today's webinar is going to focus on Care to Prepare, which is a project that looks at carers as well as older people and people living with disability. And I'm pleased to hand over to our program lead, Courtney, who's going to talk to you today. Thanks, Courtney.
Thank you, Sarah. Hello, I'm Courtney Jones. I am the program lead for Care to Prepare, and today I'm coming to you from Darkinjung country in the Central Coast. So it is widely known that people living with disability, chronic health conditions, people who are ageing, and family and friend carers experience disproportionately poorer outcomes during and after a disaster. They may require access to essential medications, equipments, and treatments that can be cut off during disasters. They may experience mobility, cognitive, or behavioural challenges that affect timely evacuation or safe access to evacuation and recovery centres, and that they generally experience greater challenges with recovery and reintegration due to a range of challenges around socioeconomic disadvantage and reliance on formal services that become interrupted during and after disasters. So Care to Prepare is delivered by Carers New South Wales in partnership with the Physical Disability Council of New South Wales and aged care service provider GoCo. The project is aimed at improving the household and community resilience and preparedness of these cohorts and reducing the impact of floods and bushfires. We have worked with people with lived experience of ageing, disability and caring to co-design and co-develop tailored disaster preparedness and planning tools, and tested these tools with people in the Shoalhaven, Central Coast and Gunnedah. The outcome of this project is the increased resilience of individuals and households through their increased awareness of the risks and their ability to identify the actions that they can take to remain safe during and after a disaster. The project is funded by the Australian Government until March of next year, and we are currently rolling out in-home one-on-one planning support to this cohort in those areas of Shoalhaven, Central Coast and Gunnedah. The co-designed toolkit has been tested with over 100 participants to ensure that it is accessible and useful and effective for people with specific needs. We've integrated the person-centred emergency planning principles, and the planning process is underpinned by those principles and that model, and is delivered by a step-by-step supported planning process. We'll soon have these resources available on the Carers New South Wales website, and as I mentioned, we're currently delivering that in-home planning support in the Central Coast, Gunnedah and Shoalhaven regions. Through this co-design approach and piloting on the ground, we have identified the 5 key steps that are crucial for people giving and receiving care to develop an effective safety plan. We know that preparedness is about understanding your own strengths and capabilities so that you can respond appropriately and have the ability to meet your needs and the needs of anybody you're supporting and maintain care routines as much as possible. Our 5 steps include understanding and identifying those strengths and capabilities, identifying people within the household, the who, how, and what is needed in the household and people in the support network. The element of preparing yourself and the home, the physical environment, and developing a plan that is effective and safe. We understand and advice from authority sources is always to leave early as the safer option. And communicating that plan with support networks is key to that plan being effective and being able to be implemented at the time when it is most needed. The first step in this, as I mentioned, is around understanding strengths and capabilities. And in our supported planning conversations, this is really about building rapport with the plan holder, the people who are developing the plan, helping them to understand where their strengths are and what it is that they can do to be prepared and to feel more confident to act appropriately. This provides the opportunity also to explain the purposes of having a plan. We know from feedback from people with lived experience of disasters that they have, in their past experience, had a rough idea in their head that they knew what to do, but their biggest piece of advice following that was to write down the actual steps and to have on paper to follow their plan so they know exactly what to do. In having a conversation that helps the plan holder to understand their own strengths and capabilities, it also sets up expectations about what might occur during a disaster, who they can connect with, and the resources that they can have available to them. It also provides the opportunity to get an understanding of how long it might take to develop a comprehensive plan, taking the pressure off, knowing that it is a step-by-step process and that a plan is always evolving. We based this first part of the conversation on the person-centred emergency planning capability wheel. This wheel was developed in collaboration with people with lived experience of disability, and it is a springboard to learn about experiences and to keep the conversation flowing so that there is a holistic understanding of how people might need to act and respond during a disaster. And we can also use this first step as an opportunity to get familiar with the risk profile of the area, asking about whether or not floods or bushfires might be something that is relevant to that plan holder. The next step in the Care to Prepare household readiness plan model is to understand the needs of the people within the household and within the immediate support networks. So we take the time to understand who lives in the house. That includes people, pets, and assistant animals. How the communication preferences and critical medical needs are noted down, and any other important information. We've also developed a section where the information about caring roles and responsibilities can be clearly stepped out and articulated so that people providing care for somebody inside or outside of the house have that information linked within that document, and anybody else who has access to the plan can clearly see that. This part of the plan is generally completed during the first or second conversation, and again, it just allows the individual to take time to familiarise themselves with the kinds of information that might be relevant to place in the plan and to get an understanding of who they might need to talk to or communicate this plan with. It also helps to understand the benefits of having all of this in one place, because we know that at a time of heightened emotional arousal during a disaster, it can be very hard to remember all these things that are kept in your head. So writing it down is the most important factor. The third step in the process is about that preparation, and we've all seen, I'm sure, the campaigns and awareness about packing an essential Go kit, things that you would need to take with you. We help the participant and the plan holder to understand what are those crucial items that they might need if they have to leave the house and be located somewhere else for a number of days. This includes things like medications, assistive technology, obviously important documents such as passports and birth certificates, and communication technology like phones, batteries, chargers, torches. any dietary requirements or feeding equipment, and of course our pets. It's essential that if you're locating somewhere unfamiliar, that you have everything you need to maintain care routines so that you can continue to take care of yourself and the people in your support network during those times where you are outside of the household and perhaps unable to access regular services. Part of the process of preparing yourself is also about preparing your home. So we do provide within this checklists and guidance on what kinds of general household maintenance could occur that would help to reduce the risk around the home. We also provide references and referrals to other support services such as the New South Wales RFS AIDA program, who may be able to assist with bushfire preparedness. So we have referred to authority sites for information to help with key activities such as the RFS and State Emergency Service SES to ensure that the advice and guidance that we're sharing is best practice information and is aligned with what the emergency services are recommending. The next step in the household care to prepare household readiness plan is to actually write down that plan. So during the initial visits and there's conversations, all of this information is starting to gather and coalesce for the person, and now is the time to write it down. We focus on leave early being the safest option because we know for anybody with specific needs, it may take a little bit longer to mobilise, to get things together and to relocate to a safe location. We definitely focus on looking at alternative places to locate, as we know that evacuation centres are not always the best place to go to, and they are not always set up to suit everybody's needs. We help with the identification of alternative safe places. We help to understand the transport options and other alternative ways to get there, and we also help to develop the communication plan. Obviously, it's important during this time to also stay informed, and we have a range of trusted sources of information that we recommend and assist our participants and plan holders to access those. There are a number of apps that can be downloaded onto a mobile phone, and they include the Hazards Near Me app, the New South Wales Traffic app, and the Bureau of Meteorology weather app. This is all just information that will help a person during the time of an emergency to have full situational awareness of what's happening around them in their area, and also to understand when and where it's safe to travel to and safe to locate at those alternative locations. And of course, the most important step in developing a plan is communicating it with people in your social and support networks. So we know often that if we have plans in our heads, we keep them to ourselves, or we only discuss them with small groups of people. It's essential that whatever is in your plan, you let somebody know so that at the time of any response, that people are aware of what you might be doing and what those alternative care arrangements are that you have made. It's also essential that if you're connected to other service providers and care providers, that they understand what you might be doing, and that all of those plans can be communicated so everybody's on the same page and out of harm's way during a disaster event. So that is our 5 essential steps in a nutshell. And again, focusing on leave early being the plan. We do know that disaster planning is not only essential for people with specific needs, but it is everybody's business. It's important that everybody has a plan in some form. And the Household Readiness Toolkit, which we are putting the final touches on now, has been designed in such a way that no matter what your level of need, you can develop a plan that's effective and appropriate for your specific circumstances. So we encourage anybody to get in touch via the Care to Prepare mailbox if you'd like to receive more information about the Care to Prepare project or the Household Readiness Toolkit. And we will have some information available on our website very soon. And so I'd like to open up, if anybody has any questions, I'm happy to talk more about the project or any of the steps in the plan, or if there's anything else that I can clarify.
Thanks, Courtney. Any questions from the audience?
Courtney, this is Kamaya. Look, I'm just wondering if you've got any time frame on when your toolkit will be ready for action.
Thank you, Kamaya. As I said, we're putting the finishing touches on it, so it will be available very soon. And I've just popped up again the Care to Prepare email address. So for anybody who's interested in receiving a copy of that, please do send me an email and I can get that out to you straight away. And of course, we'll be letting everybody know as soon as the information is available on our website.
Any other questions? Fantastic. Well, probably going to wrap up early unless there's any other final points you wanted to add, Courtney.
No, I'd just like to say thanks to everybody for attending, and you can get in touch with me via that email address, caretoprepare@carersnewsouthwales.org.au, and of course all of the information is always available on the Carers New South Wales website.
Great, thanks very much for that. And just wrapping up, I guess, bringing us back to some other events that are happening this week as part of National Carers Week. So we have one more of these lunchtime learning sessions happening on Friday lunchtime, which is focused on the different wellbeing information resources and I think education available to carers. So that will be run through by our education team. You're welcome to join that. We've also got Carers Day Out, the second Carers Day Out this week. One was held yesterday in Redfern, and we have one being held in Mudgee tomorrow. So on the off chance that any of you are in Mudgee or surrounds, you're welcome to join there. But please do also check out the other events on our website for National Carers Week. And happy National Carers Week, everybody.